Well, earlier I spoke to Sir David Nicholson, who was the chief executive of the NHS in England and is now chair of Worcestershire Acute Hospitals NHS Trust. I began by asking him for his verdict, his analysis of the NHS's response to the crisis so far.
Things that the NHS has put in place, the massive increase in intensive care capacity, the development of COVID-free areas in hospitals, all of those things been put in place very quickly. I think the overall response to the NHS has been absolutely remarkable.
What are your thoughts, though, as those frontline staff go in for their shifts to care for these patients without the proper equipment? I mean, do you feel, looking back to those times, any personal responsibility? Should we feel that we have let down those frontline staff who have given their lives? Perhaps the lack of adequate PPE could be behind some of those deaths.
There's no doubt in my mind that as chairman of my own organisation, I wouldn't want any of our staff to be put in a place that I wouldn't personally be prepared to get into myself. And I can genuinely say that in this organisation, we have managed to keep PPE in the right place, and people have, with some ingenuity, being able to carry on.
But you get the sense we're going to be able to catch up, because having fallen behind, we talked about the history of stockpiling. Now there's such global demand, it doesn't seem there's much availability globally to catch up, to buy the huge amounts of this equipment that we need.
I think it raises a whole set of issues that I remember talking about when I was the chief executive, about manufacturing capacity in this country. Over the last 10, 15, 20 years, we've lost a huge amount of manufacturing capacity in this country. So we are very dependent on global supply chains, whether that's pharmaceuticals or whether it's PPE. And I think we really do need to look at our own capacity to be able to do this in the circumstances that we find ourselves. I think that's an important point. In terms of the supply at the moment, certainly as far as this hospital is concerned, we're getting just enough. At any one time, we've probably got 3 or 4 days worth of PPE in here. So as long as the supply chain continues to do that, then I think we'll be okay. There is the question, though, coming down the line of restarting the hospitals. I think there's a lot of talk at the moment about putting more services on. I think we'll put increased demand on PPE as well. So we need to make sure that centrally people have got their act together and can deliver it in time and in the quantities that we need.
Well, I suppose did we have an element of drift then during those weeks when the Prime Minister was incapacitated due to the very virus that's causing the crisis?
I don't know. I mean, I've no way of knowing that. I'm very cautious. I have to say, I'm in the very cautious. That second spike would be a complete disaster. We need to make sure that we keep the lockdown and all of that organised. But we do need a sense of hope. And like anybody else, you need, running a hospital, being a chairman of a hospital, you need a sense of hope as to what is the broad pathway that you need to carry out to enable you to get to the place where some level of normality comes about. And I don't think yet we've had that narrative from the government. And one of the things that almost every country that's come out of it, some kind of mass testing is what you do. Now, you don't introduce mass testing, by saying you're going to introduce it. You need to take a lot of action in a detailed way.
And I'm interested here, Sir David, you of course talk about healthcare workers. Do you feel there has been a bit of, let's say, oversight when it comes to those that work so tirelessly in care homes? And the number of sad deaths we understand are taking place there. All the focus seems to be on the NHS. The government figures come from hospitals. We don't really understand or perhaps appreciate what is going on in our care homes.
On social care, this is something that, many people, we included, for many years have argued that the way we both fund it and we manage it and organise it simply isn't in the right place. If nothing else comes out of this, a really radical overhaul of social care has to be a big priority of any government going forward.